issues. We never shy away from these, and I make no apologies for some of the language you are going to hear in the next 10-15 minutes. It may make you uncomfortable. Keep the radio on. Please listen. You, especially if you're a man, because we're all guilty of this, men. When we have a cold, boy, do we let everybody know. Got a pain down below, put it off, don't you? If you've got a partner who's a man, you'll know this. So, the main male issues. Well, testicular cancer, it's prostate cancer, it's problems with the waterworks, it's mental health. All of these things are part of Movember. Now, testicular cancer and prostate cancer are huge killers of men, much like breast cancer is to women. Breast cancer has a much higher survival rate, 95% survival rate. Testicular cancer does as well, if you catch it early. So what are you looking for? Well, Adi Adiani is a consultant urologist. He's based at the Emerson's Green NHS Treatment Centre. Spoke to him early yesterday, or I should say lunchtime yesterday, and he explained the reasons why men don't talk about their health.
I think there's a bit of a complex thing in our heads, and no one's actually been able to put a finger on it, whether it's death-defying or bravado, where we think we can get away with it. My father smoked like a chimney till he was 90, and nothing ever happened to him. Oh, I've got to have this problem. And we always think we will get away with it.
Because women are much better at it, and obviously, if you take prostate cancer, which is the biggest male cancer, against breast cancer, which is the biggest female cancer, women are educated and check their breasts regularly. It's obviously harder for a man to check his prostate than it is for a woman to check their breasts. But they ignore all the basic symptoms that you know so well. The backache, the getting up to going to the loo, all that sort of... And they just put it down to age, or they just park it to one side. It can't just be difference, can it?
Well, I think I completely agree with you there. And part of the reason is the ladies have an advantage. They dick that has been taken out of doctor-patient interface, whether it's when they start their periods, they've gone to the doctor for contraception,
yes.
They've gone to the doctor, breast, cervical screening, and even things like maternity when they go over or the children are unwell, the doctor.
So the interface between a doctor or the NHS and a woman is much more regular than it is for a man who would probably go there for crisis management.
Absolutely right.
Only when there's something, a leg's hanging off will he consider going to a doctor. I mean, we're making light of this, but Adi, you're a consultant urologist. You will have come across men who have probably presented to you, having gone through the gateway of a GP, and in your heart of hearts you're thinking, there's not a great deal I can do for you, it's too late. I mean, it's the serious notion of this, isn't it?
Absolutely. Let me give you an example. I have a clinic this afternoon at Emerson Green NHS Treatment Centre, but many times, and this could very well happen again this afternoon, I hope it doesn't, you see a bloke who comes in and, walks in or waddles in sometimes and drops his, you have a conversation, oh, I've got the swelling down below, it's been bothering me for a while, but it doesn't hurt, but the missus has been on my case, so I just thought I'd get it off my back, so I've come in today and, okay, pop behind the curtain and you examine on the couch, it drops his tracksuit and you wonder, goodness, how long has this been there? And thankfully, not everything is cancer. Whether it's swelling of the testicles, it could oftentimes be fluid. But you have a bloke who is terrified, who's had this, hidden this, and not spoken about it. Perhaps the partner discovers it and is then on his case, and then eventually he presents. Or her sleep has just been bothered too much by his repeated waking up at night.
Now, you make an interesting point there. Partners play a very important role in this.
Crucial.
Absolutely, and not only
Crucial.
from the point of view of getting the man to the doctor, but of course of living with the consequences of what happens if they don't go to the doctor. And not every swelling is, it's not every swelling the worst case scenario.
Yes.
We'll take a pause for a piece of music in just a moment, and then we'll talk about some of the things that men should be looking out for in this month, over and above growing moustaches and raising money and all that sort of stuff for Movember. But let's talk about the consequences to the NHS, because obviously to treat somebody who is advanced with a male condition, and we're talking about down below those sorts of areas.
Absolutely.
When you're getting involved in end-stage treatment, that's very expensive. If you're getting a prevention, that's a lot cheaper, isn't it? I mean, just from an economic point of view more than anything else.
For the NHS, it's much easier to nip something in the bud.
Yeah.
For the family, goodness, it's so much more cheaper. But it then has implications for us as a nation as well, economically, because the later you pick up a cancer, the more you have to throw at it, until sometimes you actually can see someone with a cancer and you say, I'm sorry, I'm just going to make you comfortable. Now, thankfully, that is the minimum, the bare minimum. And you are succeeding a great deal in terms like this, increasing men's health awareness. It's not as bad as it used to be, but we certainly do have a long way to go.
We have come a long way, of course. I mean, the fact that we are
even talking about
cancer, because even doctors, a generation, they wouldn't even use the word cancer.
The C word.
I'm terribly sorry. There's nothing we can do for you. What's wrong, doctor? Well, you don't need to worry yourself about that. And that's how it used to be. They wouldn't mention it. And of course, cancer was just cancer. You've got cancer. They didn't tell you where it was. They didn't tell you, what part of your body. You just had cancer, and that was it.
Well, the NHS has also come a long way forward with the cancer to week weights and for patients sometimes who are able to make that time as short as possible between who is bold enough to make that leap and to be seen. And when I sit down in the consulting room over there in Emerson's, the first thing I want to do is make sure I don't put up another barrier for the bloke who has plucked up his courage. So I don't spend the first 2 minutes saying, you should have come much earlier. Just forget that. He's coming, he's there. So just move on.
Yes, the Beaches Brook is done. Let's get to the final furlongs. We'll talk more after this. Bristol. So it is Movember. It is an opportunity to talk about male health and actually getting men to talk about their health. Certainly if you've got a husband, if you've got a partner and you want to say, darling, why have you got that lump? It's very tricky. It's very tricky. As Addy has been talking about, it's very tricky to get a man to actually admit that he needs to go and get help, and it's intimate and it's embarrassing, and men don't like the idea of being digitally examined for their prostate, but I speak as somebody who lost father to prostate cancer, and he was a man's man. He would never have gone anywhere near a doctor, and that's why he died 20 years ago this year, because he wouldn't have done anything about it until it was too late, until he had no choice. And that's what this is about. This is about making a choice, about looking out for your own health, especially in those more intimate areas. Now, the language we use is professional language. It is the right language, but it may upset you if you're somebody who doesn't like to hear this sort of stuff on the radio. But I urge you to listen to what Addy has to say. He is a consultant urologist. He does know what he talks about. And I asked him yesterday about checking yourself, and what should we be looking for?
A bit of trivia for you. Testicles come from testify. And there was a time, if you wanted to make a solemn oath, you put your hand on your testicles. Really? Yeah. Or sometimes...
Maybe we should get politicians to do that at the moment. It may have connotations.
Absolutely. Particularly now.
Yes, indeed.
But the testicles are such an important bit. All of us, one way or the other, have come from that odd-looking bit between the bloke's legs. But sadly, many men are not acquainted with them. And really, to some extent, we as urologists are the ones who sometimes get people acquainted with their testicles. And what we need to do is not obsess about the testicles and having people with testicles 3 times every day, but at least once a month, after a nice warm bath or a good shower, when all the skin is relaxed, just kind of get acquainted with your testicles. Feel them one after the other, and particularly to know what normal feels like, so that if something abnormal does occur, then you can say, oh, that wasn't there before, that feels firmer than before, that kind of thing. And when that's done, we have the opportunity of going to the GP to say, there's a lump that's come up. Thankfully, a lot of lumps will not be cancerous. By and large, most of them will not be cancer, bearing in mind that perhaps 1 in 195 men will have testicular cancer, so then it's not very common. But between the age group that's less than 40, it is the most common cancer that men have. So it's very important.
So this is, again, Adiba, this is about prevention. This is about knowing your body, and something we've talked about on this program before. Not just look at seeing, or not just, touching, but actually feeling.
Yes.
Getting to know your own body. What about the prostate? Because, again, that is not something that a man can examine unless he's properly medically trained and he knows what he's looking for or feeling for. Everyone talks about golf balls and all that sort of stuff.
I wouldn't suggest putting your finger up.
No.
To check it out.
No, again.
Yep.
But the serious side of that, of course, Addy, is that it is an invasive procedure. It does require a digital, in the truest sense of the word, examination.
Yes.
But of course, you're talking about, and I speak from personal experience of my late stepfather who died of prostate cancer, and he was a prime example of nothing wrong with me. I'm absolutely fine.
Bloke's bloke.
Absolutely, he was, until it wasn't. Time with a lot of people listening this morning.
Absolutely.
There's nothing wrong with me until it wasn't, and then it was too late. Who's at risk? What are the symptoms? What should we be doing?
Any man above 50 is at risk. 1 in 8 men have a lifetime risk of developing prostate cancer. 1 in 4 men if you're black. So you can imagine that it is quite common. Thankfully, lots of people will die with prostate cancer rather than from prostate cancer.
You can live with it.
You can live with it sometimes. And the important thing is, if those symptoms, and the symptoms are things to do with the waterworks, so getting up many times at night to spend a penny, having trouble starting or stopping when you're passing water, difficulty when you pass water, being able to control it and having to run to the loo rather than being able to postpone it. Now, that happens many times for non-cancerous conditions. Simply a non-cancerous enlargement of the prostate can cause that. But when they have that, go see your GP. Have a check, and sometimes it's a blood test that's required, it's just a feel that is required, and tablets can make a huge difference.
Am I right in saying that the prostate naturally enlarges as you get older? I mean, not for all men.
Spot on.
So it does?
It does.
So, your waterworks will change.
With many people, their waterworks will change as they get older.
But that isn't a precursor to cancer?
Correct. Spot on.
So from what you're saying there, then, go get it checked, because there could be absolutely nothing wrong with you apart from the fact you're getting older.
Yes. And sometimes it's just a reassuring word. Maybe you want to watch out on the caffeine, it's your tea intake, because we know that for some people...
Why are you looking at me when you say that? What's wrong with me? I like a cup of coffee.
I'm just looking around the cups in the studio. Yep.
We're making light. We're dealing with some very serious points here, Addy. There is a reality, and we come back right to the very beginning of our conversation this morning. Men not taking this seriously. We, you and me this morning, Movember is about men taking their health seriously. It's also about their partners getting them to take their health seriously as well, isn't it? And making that call.
And not even just the partners, the children, the daughter, the sometimes even the colleague at work. You're getting up every few seconds. You sure you don't want to get checked? But there is so much value in partners being health aware, as it is even the blokes themselves. And that simple encouragement, and sometimes even mentioning it to the GP and trying to encourage them to go to seek help, that's very valuable. But I cannot stress enough the reduction in that barrier that people have between seeing a doctor. And we need to work on the men's psyche, that it's not a sign of weakness to seek help. I know we're supposed to be reputably horrible at asking for directions.
There is an argument to say that, and we've talked about it on this program, that actually it's a sign of strength to ask for help. To put your hand up and go, excuse me, I could do with a little bit of help here.
Yes.
That's a brave thing to do. So, if that's a brave thing to do, surely that's a sign of strength, not a sign of weakness.
It is a sign of strength. And what you've said hits on the nail one other very important area, and that's men's mental health. Because again, that's just a whole minefield where men bottle it up. They wouldn't ask their mates, I've got this lump. You can imagine someone sitting next to you in the pub and say, my nuts is,
mate, can't you do it yourself? Whereas what that good friend would do is go, you should go and see a doctor.
You should do. Whereas ladies will say, I've got this breast lump and all that. I had that before and this is what I did. But blokes say that?
A change in culture is needed. Maybe conversations like this one will help us. Eddie, thank you very much for joining us this morning. A consultant urologist, surgeon, and medical director at Emerson's Green. Many thanks for your time. Thanks.
BBC Radio Bristol.